Hypovolemic shock is related to the volume depletion, and there can be many causative factors which may trigger hypovolemic shock, such as persistent diarrhea, persistent vomiting, extensive burns, bleeding, severe dehydration, or extensive diuretic therapy. An aggressive fluid replacement therapy is required to replace the lost fluid volume and also to maintain the urine output. And various kinds of fluids can be used for this purpose, such as crystalloid fluids, then we have blood products, and then colloids. Crystalloids are the solutions, those have the same electrolyte concentration as of plasma, so they are used to replace the lost fluid volume and also to maintain the urine output. Can you recall some examples of crystalloids? It can be normal saline, 0.9%, or a lactate ringer, D5W, or a hypertonic saline, which is a 3% sodium chloride. And then we have blood products. Use of blood or blood products completely depends on the client's condition. However, if the client lost massive blood, then the whole blood is administered. And then the examples of blood products can be packed red blood cells, and it can be fresh frozen plasma or whole blood, and also plasma protein fraction. And then we have colloids, dextran 70 and dextran 40 is used as colloids. Nursing management for a client in hypovolemic shock. Establish a patent airway and ventilation, and then insert an IV line, such as we can use 16 to 18 gauge cannula, and also we need to insert a Foley catheter in to monitor the urine output. Initiate oxygen at 6 liters per minute if there is no contraindication to use oxygen, such as in COPD, and also initiate the constant cardiac monitoring to observe cardiac changes. Obtain the client's complete health history, obtain the baseline vitals, obtain the baseline labs such as CBC, electrolytes, and renal function and cardiac function. Client education. Educate the client about the treatment plan, about the rationale for the procedures, and also any changes in the health condition. We need to be notifying the client immediately. So we also need to instruct the client that if any symptoms of dizziness, headache, or shortness of breath occurs, the client needs to notify the healthcare provider immediately. Maintain the urine output at least 50 mL per hour, and urine output should be monitored every 30 minutes because the clients with the renal failure or with the renal insufficiency, they remains at the risk of circulatory fluid overload. Check the client's weight daily in the morning at the same time to monitor any fluid retention, and also listen to the breath sounds frequently because if the crackles are present, they indicate that the client has fluid in lungs. So we need to be monitoring these two indications, the weight and the breath sounds, closely. Blood products. Prior to infusing blood or blood products, the careful cross-matching between the donor and recipient is required to ensure the compatibility. And blood should be screened for carefully because there is a potential to transmit the serious infections. So that's all about hypovolemic shock, and we will be discussing the transfusion of blood in a separate video.